So welcome and thank you for joining us today for the meeting of the New York City Health and Hospitals Board of Directors Executive Committee meeting. Today's meeting is officially called to order. I would like to note for the record that the following individuals are present in a voting capacity. Philip Wadley, representing Deputy Mayor Melanie Hartzog, and Scott French, representing HRA Commissioner Stephen Banks, both in a voting.
Unfortunately, Mr. French has not joined as of yet, but we do have quorum.
Okay, thank you, Alicia. Also present are board members Sally Hernandez Piñero, Anita Kawatra, and I don't see Dave Shoxi, but Sally and Anita are here. So let's get down to the business side, which is a resolution. Should I read it, Alicia, or?
Yes, please, Jose, can you read it into the record?
So it's authorizing New York City Health and Hospitals Corporation, the system, to sign a contract with LIC.com LLC, the vendor, to provide home delivery of emergency meals to food insecure New Yorkers in COVID quarantine and isolation for a total amount not to exceed 10 million for the period November 1st, 2021 through June 30th, 2022. Ted?
Yes, thank you for, good to see everybody today, and thank you for the opportunity to present this resolution today. Just to check, I think I'm joined by Dr. Amanda Johnson on the webinar as well. Okay, wonderful. Okay, so I will dive in now. So to go into the PowerPoint presentation, we could go straight to slide number 2 here. So the background to why we're doing this and why this is important to us is one of the cornerstones of how we've been successful as a city managing COVID has been when we're doing testing and we're doing contact tracing, we always ask the most important question next, which is, what do you need? What help do you need? How can we help you to isolate or quarantine if that's what it's going to take to keep your family and your community safe? This is one of the most important answers that we have to that really, really important question. And it is our ability to deliver food to people at home, which is oftentimes the most common reason why they might otherwise have to leave their homes to support themselves and support their families. If we can deliver food, we minimize that, we're able to take away that need from people and minimize the risk of further exposures happening across our city. So the way that we've done it so far is thank you to the Department of Sanitation. They've done an amazing job contracting with 30 different vendors across the city for both our population, but also other populations as well, in terms of making food deliveries to New Yorkers to keep us all safe. We've been able to, on the T2 side specifically, we believe we can be successful with one vendor moving forward with the targeted populations that we serve, which are cases or people currently with COVID that are infectious that need to isolate. Therefore, we don't want them to leave their homes, including to get food. We want to deliver it to them. And also contact, so people with a direct known exposure to somebody with COVID that could be in their incubation period and is at risk for becoming infectious themselves should they have contracted COVID. And we want them to be at home quarantining so that they don't, when they become infectious, run the risk of infecting other New Yorkers, and we're able to break that chain of transmission. So we believe we can be successful with one vendor to do this important work, and that's our current state. In terms of where things are with the Department of Sanitation, some dates. They'll stop taking orders for our T2 clients, again, cases and contacts or those exposed, by November 15th. And then we would need to issue a new contract for emergency home meal delivery to New Yorkers to continue to support isolation and quarantine. Go to the next slide here, slide number 3. So an overview of their procurement to date. So we leveraged the procurement done by the Department of Sanitation in 2020 for these services. We conducted a closed pool solicitation among the MWBEs, awarded a contract as a result of that solicitation. On August 24th, the CRC approved an application to issue an RFP. On the 24th of August, we sent the RFP directly to 18 vendors. On 13th of September was our proposal deadline. We received 18 proposals. On the 16th of September, the first round of evaluations was completed, leaving 6. And then on the 20th of September, the second round was completed, leaving 1. LIC.com LLC received the highest score for each of the substantive criteria. Their cumulative score was 9.8, more than 2 points higher than the next highest score. If we can go to slide number 4. For the RFP criteria, in terms of what we evaluated, the minimum evaluation criteria included MWBE vendor, 3 years of experience in food preparation, existing Department of Sanitation Get Food NYC vendor, able to meet minimum weekly volume, and ability to provide all meal types. For substantive criteria, 30% was cost, 25% capacity, 25% approach and strategy and experience, and 20% data management. The evaluations committee consisted of our senior project manager for Take Care, our senior systems analyst for finance for T2, senior director of logistics, senior project manager, and our project manager for Take Care. Non-voting members included the Department of Sanitation and the deputy director of Take Care. Next slide, please. So I'm on slide number 5 now. So let me tell you a little bit more about the vendor. So LIC COM LLC is a New York City MWBE certified food service company located in Long Island City. They have served schools, child adult daycares, nonprofits, community organizations, and city agencies. They have over a decade of experience and have employed 300 local staff, importantly, throughout the pandemic, the majority from the most severely impacted restaurant industry. LIC COM is committed to delivering high quality and culturally authentic meals to T2's diverse population of clients, and has successfully operated the past 16 months with the Department of Sanitation through, as we all have seen, snowstorms, hurricanes, you name it, and supply chain shocks. They're currently the largest and longest running vendor for the Department of Sanitation's Get Food NYC program. They're the only MWBE vendor that provides 3 meal types for the Department of Sanitation's program, as almost all of the other vendors are only contracted for 1 meal type. So they have a diversity of meal types, which is important to our clients and giving them the best experience, so that they'll want to use this service, so that they will be able to, we will be able to encourage them to isolate and quarantine at home. They also had a successful reference check with the Department of Sanitation. Next slide, please. So I'm on slide number 6 now. So in terms of budgeting, based on the current COVID-19 rates and meals being delivered, we expect a spend over the next fiscal year of approximately $3 million. It's broken down to less than $4 per meal, a certain number of daily meals, a certain number of days, and that arrives us at $3 million. OMB has granted a total budget of $10 million in case of further surges with other variants that we may not know about today. We've all been humbled by the virus, and we all want to be ready and adaptable, and that's been one of our secrets to success in New York City. New York City Health and Hospitals to date has received $1.5 billion from OMB through the T2 Memorandum of Understanding, and all FY21 expenses have been covered. Next slide, please. So you got it. Oh. Oh gosh. One of these days we'll fix the internet. So to bring it full circle here, for today, the request is for approval of the executive committee to enter into contract with LIC COM LLC, a New York City MWBE, to provide emergency home meals to food insecure New Yorkers, which again has been our secret ingredient, one of our secret ingredients to enabling New Yorkers to actually be able to quarantine and isolate at home and break numerous chains of transmission. For the contract term, we list as a not to exceed of $10 million. And the contract term would be from November 1st, 2021 to June 30, 2022. With that, I would love to answer any questions or be helpful in any other way that I can, and thank you.
Thank you, Dr. Long. So let me poll board members individually to see if they have questions. Dr. Katz?
No questions.
Thank you, Dr. Calamia.
Yeah, just a couple of things, actually. So when you talk about diversity of meal type, you said 3 meals as opposed to 1. What are we referring to there? Are we referring to, a diabetic friendly versus low sodium or something? Or are we talking to different cultural type of foods or breakfast, lunch, dinner? I wasn't clear on what that meant.
More than breakfast, lunch, and dinner. That's a great question. Actually, it's been a really interesting experience for us. I would love for Dr. Johnson on the phone, if you can hear me, Amanda, to take that question. Can you hear me?
Yes, I can. Very nice to meet you, Mr. Calamaria. And I'm just so grateful to the members of the board for meeting today so that we can get resolution on this really critical part of our isolation quarantine strategy. So the types of diets that you mentioned before, low sodium, diabetes friendly, would fall under the category of medically tailored meals. And so those are meals for which we would refer test and trace clients to actually other organizations that specialize in diets that are meant to support a particular health condition. For the diversity of meal types that we're trying to accommodate here, I think we've all seen that COVID-19 has affected all New Yorkers and has hit particular communities harder than others. So when we're trying to support the goal of helping people stay at home, we need to be considerate that some people may prefer a vegetarian meal, which, though providing health benefits, doesn't qualify as medically tailored. Pan-Asian, Pan-Latin, and then standard meal types. And then kosher and halal are two other meal types that a vendor, either directly or through sub-vendors, has to be able to satisfy. Now, all meal types, regardless of which particular category, do have to meet a minimum nutrition standard. So that is just kind of a table stake for coming to this bidding process. And so when we talk about diversity, it's really being able to meet people from a kind of like cultural and traditional perspective. And one thing that sets LIC apart is its ability to satisfy multiple internally and only have one sub-vendor for kosher and halal meals.
Super. That's tremendously helpful. Thank you. Then another question is related to $3.98. So that is the budget per meal, all inclusive. So that includes delivery, that includes any administrative costs. I mean, that's our cost, $3.98. That's amazing. I think I tried to get by on that in college, and I had to spend it, and that was a while ago. But anyway, that's tremendous. That's really good, particularly given that, as you mentioned, it's nutritionally, fully equipped. And lastly, with respect to the decision making of who qualifies or not, is it basically just, does test and trace do that, and do we do it based on just a patient basically saying this is my problem, and then once we decide that they should be getting it, of course, is there a time limit, or how does that all work?
Dr. Johnson, you want to take that?
Sure thing. So as part of the contact tracing process, every intake and actually even every monitoring encounter ends with kind of a checklist of the really common things people need. So food is among there, medication support, including methadone, paid sick leave for people who are faced with the challenge of working or not working during their isolation and quarantine period. And so if they indicate some type of need and are going to be enrolled and get food, they're explaining that the program is meant for individuals who would otherwise not be able to afford grocery delivery or meal delivery, or don't have networks that can provide contactless delivery of food. So there is a light inquiry and framing of the purpose of this program, but time is of the essence when we're dealing with COVID. And so it isn't a means tested program. We're not getting applications, but we inquire with people about their ability to satisfy this on our own without stigmatizing food insecurity, just because we know that it is so common. And then in terms of the duration of the program, isolation will last as long as somebody is symptomatic and then has like a 24-hour period of resolving symptoms. Or if they're asymptomatic, then 7 days, depending on whether they're in a congregate setting, it could be a little bit longer. And so we align, given the purpose of this program, to their actual time for isolation and quarantine. And if they need food supports after this, which is not uncommon, we refer them to community resources, which our resource navigation program allows them to do.
And Dr. Calamy, if I may, because you're asking great questions here. I mean, one, I'm proud that we can offer so many culturally authentic different types of meals. But two, one of the, I think, secret ingredients, which maybe we haven't talked as much about with our program, is the number one question I get from my patients when I've diagnosed them with COVID is, what do I do now? What if I live in a multi-generation home? What if I have to go to work to support my family? And we've thought really carefully and deeply, and we take such pride in, as Amanda said, our ability to meet New Yorkers wherever they are, to give them whatever they need, whether that's direct cash assistance or paid sick leave or free hotel stay or at-home vaccinations or at-home testing or at-home meal delivery, which we've done hundreds of thousands of times through this program. This is, I think, one of the ways that we in New York City have been so successful against COVID.
Yeah, let me just say bravo to that. I'm just so impressed by it, and I appreciate your answering those questions, but that is such a critical part of all this. And, again, sometimes as healthcare, we tend to leave out some critical components. That's a huge one, and you're doing great work. So I thank you for that. Sorry for taking so much time.
Thank you. Great questions.
Thank you both. Mr. Wadley, Philip?
Just one question. Amanda, you sort of alluded to this. When this program ends, if people still need food, what is the process for them getting access to that? And is there a program separate from this that may not be Health and Hospital's responsibility, but the city's responsibility that's going to fill this gap as well?
So yes to all of those things. So one avenue that people have is at the conclusion of the program, being referred to some of our existing resources, as I mentioned before, like food pantries or other meal to go programs. If they're an elderly individual, part of the reason that we're having this conversation now is that DFTA has its own meal delivery program, and so people might be eligible for that. And then there is this emerging groceries to go program that Test and Trace and our resource navigation program is also supporting the transition to. And so that, I think, is going to become actually a primary destination for people who are food insecure after their isolation and quarantine period ends. So very grateful to have the city. While it seems like we're shrinking this program, it's only so that we free up resources to actually create a more durable solution.
Great. Thank you.
Thank you.
Mr. French, Scott French?
No questions. Thank you.
Thank you, Dr. Peñamora.
Thank you, Jose. I'm sorry, I'm having some problems with my audio. I just have a question. Again, this is something that came up during the mayoral primary contest, that there were some comments about food waste in this program. Again, I don't know the details, but I remember there was some comments that were published. How do we ensure that the food is delivered on time to our patients or whoever needs it? And how do we track any waste that may be in the system?
Yeah, this is Ted to start here. Great question. And that's part of the way that we came to the vendor selection that we did here, was looking at the experience we've had with other vendors and the ability of this vendor to really deliver on the promises that they make, which are make or break for the ability of New Yorkers to stay at home for isolation or quarantine. So there's so much at stake here that we took that extremely, extremely seriously. Dr. Johnson, I don't know if you want to weigh in on more of sort of how we look at that on the day-to-day, and if you have any thoughts on the waste aspect.
Yeah, this is a really great question. It's how can we be so replete in some places and so scant in others? So on kind of an operational level, so it's daily invoicing to, or rather I will say daily reporting of the deliveries that were made and the deliveries that were unsuccessful. And if people miss 2 successive deliveries, then we reach out to ensure that they're still interested in the program, that we haven't had an address issue. So try to understand, did we make a mistake that is causing them not to make use of this resource? And then for the undeliverable food, they're donated to local nonprofits who have to provide proof that yes, they received this donation, as well as their EIN number. So kind of operationally, how to minimize excess deliveries in the first place, and then having a system for making sure the food doesn't go to waste.
But in that system, do we get feedback from the people that we are serving? Because I think, having the companies kind of report, we are missing a very important component that in some areas are called customer service satisfaction or something. Are there mechanisms that people that are supposed to receive, if they don't receive it on time, or they receive a spoiled food or food that is not really kind of looking good to eat because it has been shaken or beaten or whatever, how do they report back, and how do we keep track to ensure a level of quality? I think this is an important program. I think that you guys all of you will be doing a great, amazing job. But how do we ensure that, again, we're talking about, and Dr. Calamia mentioned $3.28, that's very inexpensive for a meal, that the quality and the appeal of the food is not only the nutritional value, but sometimes food enters through the eyes and through the smell. And we want to ensure that is as appetizing meals as well. So how do we keep track of that customer satisfaction?
Dr. Johnson, do you want to start on that one?
Sure. I mean, it sounds like we have a biologist on the phone. It's very true. The hormones for digestion get triggered upon sight, upon smell, upon having that gustatory sensation. So yes, a couple of ways that we manage this. First, prescribing, packaging, and labeling and presentation requirements. It's another reason that we don't allow frozen food. This all has to be freshly prepared meals, because we understand that if it's not something that someone wants to eat, they're going to leave their home. A couple ways that we get feedback. So people are encouraged and welcome to provide feedback either through the website or through the customer service line if they're encountering that the food doesn't taste good or they're concerned about spoilage. And honestly, there are triggers in the system so that if a word such as spoiled comes up, it gets fast-tracked, because we take things like that very seriously. Other ways that we are monitoring the quality of the food is through secret shopping. So not a large proportion, but being able to actually say, what is it that people are receiving on their doorstep? And then during the period of Get Food prior to when it was going to come under H&H, but it was still DSNY, we actually had a bit of support from EDC to do some market research and get a sense that excellent brand awareness of the program and a high degree of satisfaction with the food. What I will say is that these are prepared meals, and I think part of the genesis of the Groceries to Go program is that people, when they're not feeling very ill, want some autonomy of food preparation and still want to engage in that. But for a program that's meant to serve people who are living with and have been infected with COVID, the better part of Valor is to give them the meal fully prepared. And then Groceries to Go helps with kind of that other need that was surfaced through the research, the market research effort. So kind of multiple levels of us going out and trying to find information, as well as having channels for receiving and fast tracking, particularly unacceptable food complaints.
Yeah, and this is that I think
changes
please,
have to
Dr.
be
Johnson,
pre-approved.
yes.
Sorry. And I was just going to also add that all menu changes have to be pre-approved. So they can't say, oh, we're out of oranges this week, we're going to put Kit Kats in there. No, like we want to promise nutritious meals and deliver on that.
I think you could tell how passionate Dr. Johnson is about this topic and how much work she's put into this. And it really has been. I just want to say, it's the most popular part of the resources that we give to people in New York City. And I really believe, and I've learned this even more through COVID, that New Yorkers really do vote with their feet. If they don't see value in something, or their friends had a bad experience with something, they will not do that thing. The fact that we've done this hundreds of thousands and a growing number of times really speaks to, I think, our ability to be culturally authentic and give people something that they not only value, but again, as Dr. Johnson said, the better part of Valor is our ability to help them to truly be able to isolate and quarantine at home. And that, again, I think is one of the reasons we've been able to control COVID to the extent that we have. So great question. And Dr. Johnson hit all the main points. I just wanted to add that.
Thank you, Dr. Johnson. I really like the idea of the secret shopper. I think that's an important component for quality. So because you are kind of the receiving end and see both the service and the quality. So thank you. I have my last question is about the transition. Is this the same vendor that provided the services to DSNY, or is a different vendor?
It is the same vendor. It is the largest and longest running vendor from the DSNY program. And so they have a track record. And then their sub vendor is also someone part of the DSNY program, which should aid in the transition process.
Okay, and so the transition is expected to be very smooth because it's the same vendor. It's just kind of more behind the scenes, who owns the contract, who pays, and where those invoices will go. But in terms of the delivery, there is not going to be any stop or any delay in any delivery. Is that correct?
Precisely.
That is correct.
Okay, and the issue for the outreach of anybody, can you elaborate? How do you do follow-up, or what is the methodology to ensure that people know the service and are able to get access to the service?
Mm-hmm. I'll start and then I'll see what Dr. Johnson wants to add. So Fanny, this is actually how we do contact tracing. So if you're a case, when we're completing our interview with you, before you get off the phone with us, we're going to offer you resources, including this. And that's been such an important part of our program. And if you're a close contact or somebody with a known exposure to somebody with COVID in New York City, we're going to do the same thing. We're going to offer you a set of resources, whatever you need to help you to effectively quarantine at home. That's what we're going to offer you, whether it's a free hotel stay, whether it's meals delivered at home because you're able to stay at home, and whether it's direct cash assistance or paid sick leave in order so that you don't have to go to work being the reason that you'd have to leave your home. So we offer these resources to everybody that comes through the program as part of our contact tracing work in general. And I think that's something unique about New York City that I'm especially proud of, because through contact tracing, it's not just about identifying contacts. It's about the millions of opportunities we've now had to connect New Yorkers to what they need in order to get through this and to break chains of transmission.
I have very little to add. I think Ted summed it up. We rope this into a network for reaching out to people either by phone or by going to their doorstep. And then the one thing that we actually now have the ability to do, since it's a single vendor and some of the operational complexities are mitigated by just having one administrator of this contract and one prime vendor, is that we can actually now start putting resources into the package itself to help people prepare for when their meals are about to end and how to transition to a more long-term service.
And the final thing I'll say is I'll use this as an opportunity to let everybody know that New York City has just passed 1 million close contacts, which is 1 million opportunities to do things just like this. So we've been able to I can't help but put in the plug here, but it's an amazing accomplishment. In the beginning of the program, we were identifying, contacts starting on June 1st, and we've now surpassed 1 million people we've identified, of which 72% we've had a live conversation with. So that's in New York City, the way that we've been able to, I think, keep our city as safe as we've been able to.
Thank you and congratulations to you and the team. And again, thank you for Dr. Johnson for leading this effort. It's really an impactful one, and I know that it's going to go to the next level of excellence on their health and hospital. Nothing to say about DSNY, but I trust the team and health and hospital. So thank you so much.
Thank you, Fenny.
Thank you. So we also have two more members with us today on the meeting. Sally Hernandez Piñero, do you have any questions?
Yeah, I have a number of factual questions. I think I got a little bit confused. Was DSNY offering the service and now we're going to take it over?
Correct.
Okay. Why are they not offering it anymore?
It's a good question. I'll start and then I'll turn to Dr. Johnson. They've been offering it. They started to offer it sort of at the height of the emergency. And now for the T2 piece of this, which is serving our clients of the test and trace core, they've been continuing to serve our clients over this amount of time. But now they felt, and we agree, that rolling the different services that we do under the test and trace core, may make the most sense as we finish off the pandemic, if you will. But Dr. Johnson, I don't know if there's anything you want to add there.
Sure. No, it's a good question. And to think about the original purpose of this program, it was not just for isolation and quarantine of known cases and contacts to the extent that you could know whether you had COVID when we couldn't test effectively, but also to support some of the non-pharmacologic interventions for controlling the pandemic. So allowing people truly to stay at home. Since in the past 18 months, the goals have changed, and we had originally planned for a transition, going up on 10 to 12 months ago, and decided that given where we were in the pandemic, the time wasn't right. I think we've now reached a period of relative stability and maturity of our operation that we've prepared to take this on. And then from a, I think, more technical standpoint, these contracts were procured during the emergency order, and so using a different procurement process, and we would not be able to renew all 30. And so I think a lot of things coincided to say that now this is the appropriate time to make this transition.
So how long did they run the program and how many meals did they serve?
Dr. Johnson, you probably know the numbers better than I do. It's generally hundreds of thousands, but if you want to be more precise.
Yeah, so I know that the program, I believe, started in March or February of 2020 under DSNY, and I think we can get an actual per meal total delivery under DSNY. I don't have it at the ready for you, but we can follow up with that.
Okay,
say is that right now we would be doing about 3,000 meals per day just for test and trace clients, whereas the larger DSNY program that's being dismantled and given to its appropriate long-term owners is 637,000. Just to give you a kind of a magnitude.
Okay, so where you say $3.98 a meal, you mean $3.98 for 3 meals?
I believe it's $3.98 for one meal, of which you could have 3 meals delivered in a given day. Dr. Johnson, is that right? Oh, Amanda, you might be on mute.
Yes, trapped on mute. So it is $3.98 per meal. A lot of times these meal packages will come in 6 meals at a time. It could be 3 meals at a time, but to kind of get rid of that variability, instead of using per delivery, we're talking about per meal that gets delivered.
So the 3,118 meals really could be divided by 3 and be 1,000 meals if they were getting 3 meals a day?
So if you were to take the 3,000 and divide it by 3 meals per day, then it would be, you know, a 1,000
Yeah.
Yes.
days of meals.
So you're delivering 1,000 meals times 241 days, 241,000 meals.
So 241,000 person meals. So
Yeah.
I think that math works out.
And you're doing that over, you say a fiscal year, but you say next fiscal year, but I think you mean
For the duration of this
balance
fiscal,
of this
starting
fiscal year?
correct. So starting November 1st for the balance of this fiscal year. Correct.
Okay, I would just clarify that.
Yeah, good question. Yeah.
So 240,000 meals over the course of about 8 months. So 30,000 meals a month you're delivering.
Yes.
Okay, I'm matching that up with the number of our encounters, which is why I'm struggling a little bit, because as you pointed out, we've had 1 million encounters, 750,000, you just said, in-person encounters. Was that over the course of 1 year? I'm not
Good
sure.
question.
Figure out how you'll meet the numbers that we've been encountering.
Yeah. So I can clarify that. So when Test and Trace Core launched on June 1st of 2020, every day since then, we've been collecting close contacts of people with COVID in New York City. We recently reached the point where since June 1st of 2020, we'd surpassed 1 million close contacts being identified since again launching on June 1st. So it's been more than a year. It's been a year and a third or something like that.
Right.
For that whole time, the Department of Sanitation has been providing the meal deliveries that we offer to everybody. Not everybody takes us up on it, but we offer to people that would benefit from having a meal delivered to their home if that's what it would take to enable them to effectively isolate or quarantine at home. Moving forward, we're going to continue to identify close contacts and continue to offer them and cases or people with COVID in New York City meal deliveries if this resolution is approved. And this is about how many we think we're going to need to get us through the balance, to use your words, of this fiscal year.
Okay, I guess I'm assuming then that the velocity of cases has decreased substantially, because once you have contacts and then their contacts, it sort of becomes like these tentacles that are ever expanding. But I guess you've concluded that because the numbers must be declining, that this is going to be sufficient over the next 8 months.
Correct. That's absolutely right.
Okay, thank you.
Thank you.
Thank you, Sally. And Anita Kawatra, any questions?
No further questions. Dr. Calamia actually covered the ones I had.
Yeah.
Thank you.
I think Sally covered the questions I had. So let me then call for a vote. All in favor of the resolution, please say yes.
Yes.
Opposed, please say no. So the resolution is approved. Is there any old or new business to come before this board?
Just a quick question. These are 10 million new dollars that OMB is giving us. Is that right?
Through the MOU, yes.
Yes. Okay, thank you.
Thank you. Is there any any other new business to come before this committee? Is there no further business? Then I declare the meeting adjourned. Thank you so much.
Thank
Have a
you.
great afternoon.
Congratulations.
Thank you, everybody,
you.
for helping us and
Everybody,
putting
bye.
together this meeting. We really appreciate it for getting this done. Thank you. I know it was an additional burden compared to last week's meeting. This was obviously time sensitive, and we appreciate board members coming together to help us. Thank you.
Thank
Thank
you.
you
Yes,
so
thank
much.
you very much.
The least we can do to support all of you. You are doing the hard work. So thank
Exactly.
you for giving us the opportunity. Thank you.
Thank you.
Bye-bye.
Bye-bye.
Bye-bye.